evening. I'd like to welcome all of you to our first Politics, Law, and Economics lecture of the 2009-2010 academic year. My name is Derek Yonai, and I am the Lundy Chair of the Philosophy of Business here at Campbell University. The Politics, Law, and Economics lecture series is designed to highlight the three institutions that must work in concert to support and defend a free and civil society. Those institutions are good governance, the rule of law, and free markets. Recently in the news, we've heard much about healthcare reform, and tonight our speaker will address those issues. Our speaker this evening is Mr. Joseph Coletti from the John Locke Foundation. At the John Locke Foundation, he serves as the Fiscal and Healthcare Policy Analyst, and this is his second tour of duty doing a PLE lecture for us. Several years ago, he did one on the North Carolina gas tax, and tonight he comes to us to discuss possible reforms regarding healthcare. So please join me in welcoming our speaker this evening, Mr. Joseph Coletti.
Not nearly as many people were interested in the gas tax. I want to talk about the healthcare system. Now, when I sent this presentation, around to some people that I work with, just to see what they thought of it and to kind of get some ideas, and also to let them know this is a new piece of software for me. So look at the cool things you can do. And they saw these really ugly flow charts on the side, and they said, "Oh yeah, you're just showing off." But really, one, I would never just put something as ugly as that gray one together on my own. But the gray one is what the Republicans say the House bill would look like. That's a portion of what they say the House bill would create. The one on the left and the one on your right is what the New Republic says the current healthcare system looks like. And the difference in both of those, between what they show and what actually is that we don't really have a healthcare system, and that's one of the things that's important. And it's not, and I don't say that disparagingly, as a lot of people do. People talk about how we have dysfunction and we have these parts, but really we have half a market, a crippled market is what we have in healthcare. The U.S. government pays half of our healthcare costs. Insurance companies and employers pay 87% of the healthcare costs that you face when you go to a doctor. On average, each of us only pays $1 out of every 8 when we see a doctor out of our own pocket. That's lower than in Canada, which has a nominally socialist system. That's about the same level as in France, and it's much lower than in Switzerland, where people pay about 33% out of pocket. And that's part of, I think, the problem with it. And I'm going to throw out, I threw out that statistic. I'm going to throw out maybe another statistic or two. But really, statistics miss the point when it comes to talking about healthcare and when it talks about most public policy debates. One reason is that we use the statistics that back up our arguments. The president will use that he told George Stephanopoulos that on average people pay $900 more in their health insurance premiums because of uncompensated care. If you take a look at what is said to be the average cost of health insurance, that's about $10,000 a year. $900 of that is 9%. Now, I've seen numbers, though, that say that on average, the cost of uncompensated care is about 2% to 4%. Now, there's a huge gap between 9% and 2%. So I'm not going to talk about statistics a lot, and I'm going to keep that part for the questions, so that if you all have questions about a specific statistic or a specific bill or anything like that, we can do that in the questions. But I'm not going to talk a lot about statistics, but when you do hear the statistic about 30% of our healthcare costs are wasted, are spent on unnecessary care, are spent on useless things, and where you have higher costs but no real benefit from it. And that all sounds good, but you get to the other problem with the other question of that, which isn't a statistical question. It's which 30% is wasted. Is it the 30% that goes to somebody who's dying in their last year of life? Where I've talked to a lot of people in Washington, D.C. who think that healthcare is a right, but they turn around and they say, but we spend too much money on people in the last year of life when they're going to die anyway. Suddenly they've lost their right to healthcare. When you take a look at the beginning of life, and a little girl born in Hamilton, Ontario, 4 months premature, they could not find a neonatal intensive care unit anywhere in the province of Ontario for her. Now, the province of Ontario, Hamilton's a pretty big city in Canada. The capital of the entire country of Canada, Ottawa, is in Ontario. The largest city in Canada, Toronto, is in Ontario, and in none of those cities was there a neonatal intensive care unit for this little girl. She had to go to Buffalo to get the care. Now, my friend Dallas Woodhouse at Americans for Prosperity says, you know, when we talk about healthcare, we're not just talking about you and me and Americans. We're not talking about what we're going to do to our healthcare. We're talking about what we're going to do to Canadians' healthcare, because they come here because they can't find it there. Another thing that we hear about a lot is, let's let the experts, let's have a panel of experts be in charge. But popcorn, this finally explains why I've got a picture of popcorn up here. I know some of you are wondering. Popcorn's gone through like 3 or 4 different phases of how you're supposed to cook it in movie theaters. Right? They started out, they used palm oil or coconut oil, which had saturated fat. And so everybody said, oh, that's awful, you have to stop doing that. So about 20 years ago, they stopped using coconut oil to make popcorn in movie theaters. And then people said, well, it doesn't taste like it anymore. But it's true, but they switched to a non-saturated fat. They used vegetable oil. And then, about 5 or 10 years ago, people realized, oh, well, the vegetable oil creates trans fats. And trans fats are even worse than saturated fats, so we have to figure out another way to cook popcorn. And the thing is that the illustrative point about that is that as good as healthcare research is, it changes. The reason why you think that you've heard that eggs are good for you and eggs are bad for you is because you have. There's science, there's conflicting science on both sides, just like with the statistics. So it's not about what the statistics say. And really, if you think about it, you know, oatmeal versus grits. Those of you from the north are probably thinking, yeah, oatmeal is much better than grits. And those of you from the south are saying, grits are the only thing that you eat. And grits are about half the price of oatmeal. But they're slightly less nutritious. So we have the difference in personal preference there. But if you do comparative effectiveness research, comparative serial research, that's how we're supposed to, that's what the panel of experts in healthcare is supposed to tell us. Which treatment is effective and which treatment is cost effective? Which one should we be spending money on? And insurance companies do that already. They tell you don't take the brand name drug, take the generic drug. But if you take a look at it within cereals, grits are half the price, but they're slightly less nutritious. Which one do you do? More realistic, at least for me, probably for some of you, is, you know, Frosted Flakes. Tony the Tiger, Kellogg's Frosted Flakes versus Multi-Meal Frosted Flakes. Multi-Meal Frosted Flakes are, Kellogg's is about a third more expensive for basically the same product. If you take a look at it nutritionally, they're exactly the same product. Multi-Meal has done a very good